and next 10 years or 20 years or whenever I fall sick, I hope we'll be able to make use of all this clever technology which has been developed. We all know this, that we are a poor country, we have limited resources, there aren't that many doctors, there are just too many patients. I think part of the problem with this is, and it's a bit ironic, you sit in an air-conditioned 5-star hotel and you have these fancy conferences talking about stuff like this, whereas when this is your target population which we're talking about. And this, I think, still remains a big problem. Will patients accept telemedicine? And even in my own practice, patients aren't happy unless they actually come and talk to me and they see my face. And in all the reality, I actually tell the patient, don't come to my clinic, don't telephone me. I'd rather you want to talk to me, do it by email. Everything is documented, it's in black and white, it's much easier for me to reply. Fortunately, infertility is not an emergency situation. It gives them enough time to think about their questions. It gives enough time for me to craft my answers. And most of these are questions I've heard before, so often it's quite easy for me to copy and paste. So just a simple application, like just bread and butter basic email, is such a simple telemedicine application which I use every day. But part of the problem is that patients need to be educated. They kind of feel, do I need to see the doctor? Will the doctor understand? In reality, for example, even if a patient comes to my clinic, these days with infertility, I don't even need to do a physical examination because lots of medical treatment today depends on laboratory investigations or tests. So for example, a urologist will be even more interested in what the ultrasound examination of the kidney and the bladder shows rather than actually physically examining the patient. So they're often treating patients today based on lab reports or scans. The question, of course, is what will this do to the doctor-patient relationship? Does anyone have any feelings about this? Do you think doctors will become impersonal, will become widgets, patients won't care anymore, we'll all become, your Dr. X, the Dr. Y, or Dr. Z? Does anyone have any feelings? Because you're doing this through telemedicine, you're doing it through looking at a face on a screen, you're no longer actually walking into a doctor's clinic and actually seeing the doctor. I actually think it will help to enhance the doctor-patient relationship. I don't think it will detract. And the reason for that is even today in reality, you will spend anywhere from 2 to 3 hours waiting outside the doctor's office to see the doctor for literally a 2 to 3 minute darshan from the doctor, because most good doctors are extremely busy and that hardly creates any satisfaction. Whereas I think it's possible to use a lot of this technology to help to improve the doctor-patient relationship. And that's what I'm going to talk about. But I think this is my most important slide. I think all the time we keep on thinking patients are the problem, there are too many patients don't have enough money, how do we get hold of them? And I think in reality, patients are the largest untapped healthcare resource. Part of the problem is we look at patients incorrectly. We think of patients as consuming healthcare resources. Actually, we need to remember is that patients are actually the providers. And because we're all doctors, all we think about is what we provide as medical care is when the patient comes to me and this is when I treat the patient, that's the medical care. But actually over 80% of healthcare is actually provided by the patient. And that's true even today. Even today, you're the one who decides when you want to go to a doctor, which doctor you want to go to, whether you're happy with your doctor or not. And I think lots of these opportunities exist in India simply because it's such a broken system right now. Fortunately, we're in a demographic sweet spot. There are lots of clever doctors, lots of clever entrepreneurs. But I think the important thing is we need to focus on these opportunities and we need to look for solutions and not for problems. And we also have these great 7-star hospitals in Bombay. The fact is, I think the problem today is that patients are not happy with their doctors. Doctors are too busy, or doctors just want to do tests. They kind of over-prescribe, over-treat. And what really patients want is the old-fashioned, what they used to think the family doctor of the past who knew everything about you. But unfortunately, that doctor has gone away. I just need to remind you that all of us are on the same side, that we don't need to create this doctor versus patient confrontational relationship. We need to start creating win-win situations. And I think the best way of doing this is what I believe is called the positive deviance model. You look for success stories and then you scale up these success stories. This is the most important slide, is that we patients, when I'm sick, for example, the first thing I don't do is pick up a phone and talk to my doctor. I don't look up at the web or whatever. I still make a lot of these decisions for myself. I think the important thing is that we need to empower patients with reliable information so that when they make these decisions, they're sensible, right decisions rather than unreliable information. And the key question we need to ask ourselves is how can we as healthcare systems educate and empower our patients with information so that they make the right decisions. This is a very simple thing which actually amazes me why more people don't have. Why shouldn't every hospital have a patient education resource center? You have all these patients who are waiting for their doctors. You have all these patients' relatives who have hundreds of questions about what's happening. You have all these doctors who are too busy to talk to patients. Whereas if you had a place like a patient education resource center, a lot of these problems would be solved. And equally importantly, this is what our big goal is. We think every doctor should have their own website. There is a one-time cost. You know, people say doctors aren't savvy enough, how will they do it? But I think doctors are reasonably bright. The great thing about once the doctor has put up the website, a lot of communicating information to the patient, all the problems go away. The patient trusts me. The patient doesn't trust Google, but the patient trusts me. So if the patient comes to my website, which is drmalpani.com, the patient knows the website information is reliable. My job as a doctor is to make sure that I provide reliable information. And the great thing is that I'm providing a win-win situation. It's good for me as a doctor to have a website. It helps me to attract patients. I'm willing to update it and spend time and energy. And it's obviously good for my patients as well, because then they can reach out directly to me rather than to have to go through a middleman. So it helps to encourage trust and reliability. This is what websites help to do. It actually helps doctors to become more empathetic. Because you're creating a website for your patients, it helps you to look at things from the patient's perspective and the patient's point of view. A big criticism about a lot of the websites today is all the information is in English. And there's much more information on mayoclinic.com than, let's say, apollohospital.com. And actually, I think that's an opportunity. If I were a general practitioner sitting in Surat, I would put up a website which would be in Gujarati for my patients. And these days with a flip camera or with a mobile, it's not very hard to, you know, just videotape a consultation. And suppose I were a pediatrician, I'd take the 20 commonest problems which I see in my practice, diarrhea, failure to put on weight, fever, whatever else, and I just have a conversation and then put it up on YouTube, and then anyone in the world could watch. And I'm not depriving myself of my patients, because any patient who then decides they still want to come and see a doctor are much more likely to come to me rather than to come to someone else. So these are all easy, inexpensive things to do. But even better, I think, once you have these websites, you then have patient portals, and then you're allowing patients to share information with themselves. And let me tell you one thing, every good doctor will tell you the only way to learn medicine is from your patients. Unfortunately, patients aren't articulate, or doctors are too busy to listen to patients, but the moment you're opening up these channels of communication, there's so much more information coming in. So we really need a bottom-up approach, listen to my patients rather than the other way around. And that's all about what I call listening to the patient, or giving patients a voice. Patients have blogs. There are great sites like Patients Like Me, where patients actually record what's happening to them. And it's a great way for doctors to learn about what patients actually experience. And of course, it allows them to rate doctors, and which is good. You know, it's good for doctors to be disciplined, because if you're rude and an unhappy patient thinks you're rude, they're going to tell the rest of the world about it. So you're going to be on your best behavior when you're talking to patients. And that's the book which we've written, which basically summarizes that we need to use what we call information therapy. And this information therapy is a win-win situation. It's good for doctors to provide it. It's obviously good for patients to receive it. It's good for the entire healthcare system. It's a very inexpensive way for the government, for example, to make sure that care is provided and best is care which is appropriate. It's good for pharmaceutical companies. It's good for health insurance companies. So that's my last slide, is that it's simple enough. It's just the right information to the right person at the right time. And the great thing about it is empowers you. You're no longer dependent on your doctor or your professional. You understand that, yes, you can take care of your own problem. Because it's information therapy which is published, it's based on scientifically validated, evidence-based guidelines. So you know what's right, you know what's wrong. And equally importantly, it helps to reduce unnecessary testing and unnecessary surgeries. Because if the guideline says that just because you have heavy menstrual bleeding doesn't mean you automatically need a hysterectomy, a lot of patients will say, no doctor, I don't want a hysterectomy done, I want alternatives. That's our solution. Thank you.